Imagine feeling great after surgery, then suddenly you feel warm and tired. You might wonder, is this just my body healing, or is something more serious happening, especially with my incision? A low-grade fever, typically below 100.4 degrees Fahrenheit or 38 degrees Celsius, can be normal within the first 48 hours after surgery as your body responds to the trauma and inflammation. However, a persistent or rising fever, especially one above 100.5 degrees Fahrenheit or 38.05 degrees Celsius, after the initial 2 days, often signals a potential wound infection or another complication that needs immediate medical attention. Your body's immune system naturally kicks into gear after surgery to repair damaged tissue. This process, called inflammation, can cause a slight temperature elevation. Think of it as your internal repair crew starting their work. However, when bacteria invade the surgical site, your immune system launches a more intense response, releasing chemicals that raise your core body temperature significantly higher. This heightened immune activity is what drives a higher, more concerning fever. To tell the difference between normal healing and potential trouble, first, keep a close on your temperature. Measure it orally at least twice a day, or as your doctor advises, and note any changes. Second, inspect your wound carefully for other classic signs of infection. Look for increased redness spreading beyond the incision line, swelling that worsens, new or increasing pain, warmth radiating from the site, or any drainage that looks cloudy, yellow, green, or has a foul odor. Lastly, pay attention to how you feel overall. Chills, persistent fatigue, or a general feeling of being unwell often accompany a serious infection. A key indicator your healthcare team considers is the timing of the fever. Fevers occurring within the first few hours are often related to anesthesia or lung issues, whereas fevers that develop 4 to 7 days post-surgery, or even later, are more likely to point directly to a wound infection. Your body needs time for bacteria to multiply enough to trigger a noticeable systemic response, and that typically takes a few days. Understanding the difference between a normal post-operative warmth and a concerning fever empowers you to be an active participant in your recovery. By monitoring your temperature and diligently checking your wound for specific changes, you can confidently communicate with your healthcare provider. This proactive approach ensures that any potential wound trouble is identified and addressed quickly, guiding you back to full health safely and smoothly.